where I get to introduce or reintroduce our speaker. Dr. Eric Garland is a distinguished endowed chair in research, distinguished professor and assistant dean for research in the University of Utah College of Social Work, and the director of the Center of Mindfulness and Integrative Health Intervention Development. Dr. Garland is the developer of an innovative mindfulness-based therapy founded on insights derived from effective neuroscience called Mindfulness-Oriented Recovery Enhancement. He has published more than 220 scientific manuscripts and received more than 70 million in research grants to conduct clinical trials of mindfulness for addiction and chronic pain. In recognition of his expertise, Dr. Garland has worked with, was appointed by NIH Director Dr. Francis Collins to the NIH HEAL Multidisciplinary Working Group to help guide the 1.1 billion HEAL initiative to use science to halt the opioid crisis. In a recent bibliometric analysis of mindfulness research published over the past 55 years, Dr. Garland was found to be one of the most prolific authors of mindfulness research in the world. So welcome back, Dr. Garland.
So I think if you all recall my talk from last week, I discussed mindfulness-oriented recovery enhancement, which is an integrative therapy for addiction, emotional distress, and chronic pain that unites three great traditions within psychotherapy. The first is mindfulness training, the second is cognitive behavioral therapy, and the third is positive psychology. And it integrates these components as a manualized treatment approach. And this approach was developed over a 10+ year period of many clinical trials, testing the efficacy of the treatment, trying to understand its mechanisms, how it works, and then we used what we learned from those studies to make the intervention better. And the foundation of MORE is mindfulness, which we discussed last week. And mindfulness is a mental training practice that involves cultivating awareness and acceptance of your thoughts, emotions, and sensations in the present moment, and observing those experiences as if you were a witness, as if you were an objective observer. And this is the quality of meta-awareness that becomes strengthened in every mindfulness practice. And mindfulness is not a relaxation technique, although it is relaxing, but it really is about cultivating awareness. And so last week I summarized the key studies in the research literature on MORE, and what we see across, I think it's 10 randomized clinical trials now involving well over 1,000 patients, is that MORE, it significantly decreases addictive behavior and craving. MORE also reduces chronic pain symptoms and reduces emotional distress. At the same time, MORE enhances positive emotions and increases the sense of meaning in life. And MORE seems to do this by strengthening self-regulation or self-control, and also by eliciting experiences of self-transcendence, so connecting with something greater than yourself. And so really, I'm focused quite intensely on dissemination. That's why I'm here today. I want to help spread this therapy around the country, and I'd love to see it become part of standard addiction care. And so you can see that there's clinicians in a number of cities all around the country and around the world who are delivering MORE. I've trained about 750 social workers, psychologists, nurses, and physicians to deliver MORE in a variety of practice settings, and they are at present, many of them are actually receiving insurance reimbursement for delivering this intervention, and I think it has a lot of promise. So that's an overview. Oh, one more piece. If you recall, one of the things that makes MORE quite unique among addictions treatments is its focus on enhancing natural reward processing. And this makes sense in light of well-established neuroscience models of addiction showing that as a person becomes more and more addicted, their brains become less sensitive to natural, healthy pleasure. So the person becomes less able to make themselves feel good naturally. They get less pleasure out of and joy out of the things, the people, and the values that they once held to be meaningful, because the drug really hijacks the reward system of the brain. So guided by this well-established observation in addiction neuroscience, I developed more to directly target that deficit by teaching people how to mindfully savor the good in their lives, and to really try to extract the pleasure out of those events, natural, healthy pleasure. And if the person can learn how to make themselves feel good naturally, then maybe they won't need to turn to a drug to find that source of pleasure. So that's the concept, and we tested it in many ways using neuroscience, and looks like it works. Looks like, in fact, that when you use mindful savoring techniques, that it actually does increase the brain's sensitivity to natural, healthy pleasure. And the more sensitive the brain becomes to natural, healthy pleasure, the less the person craves the drug. So that's probably the most exciting scientific finding in my career, and I think it has a lot of clinical relevance for folks working in the field. This is sort of a new realm of treatment that we can not only advance through more, but I think other addiction therapies could also kind of leverage this idea as well. So that's a very brief overview. I'm happy to get into any of those topics in more detail. So just ask me a question if you've got one. I know there's a few questions to start that were left over from last week. Is there a resource list of organizations or providers that are offering more groups? Yes, there is a list of providers. I need to update it on my website. There are some names on my website already, but that actually needs an update. So I do have a list of individuals who are offering more interventions. So if you're interested in that, either reach out to me or go to my website, and you can see. Actually, I guess I could maybe share my screen and show you where it is. Well, if you go, just to keep it simple, if you go to my website, which is www.drericgarland.com, you go under the More tab. There's a list of providers there. That's where to find that. And some of them do, in fact, offer more through telehealth. And we recently did a couple of telehealth studies and found that delivering more over telehealth does work. So that's great to know, because that increases access to the treatment. I'm still old school, though. I still think face to face with a human being is always better. But if we can reach people in rural locations who don't have access to therapy, then it's a good thing. For non-clinicians, what can we do to promote using more related interventions and skills with our clients? Or is the most appropriate thing just to refer to therapy? What do you mean by non-clinicians, I guess, is my question in response to this question. You're talking about peer support specialists?
My guess is that it would be peer support specialists or care navigators.
Okay. Well, I guess I'm not clear on the role of a care navigator. Is that like case management?
Yes, that's one part of it.
Okay. Case management, what can you do? You can refer people to more. But peer support, I think, I actually have trained a number of peer support folks to deliver more. They're not certified in more. You have to have, in order to be certified, you'd have to have you have to be a licensed eligible healthcare provider, but you don't have to be certified in order to use more. And so I think it's possible that peer support folks could do more with their the folks they work with, and could be helpful. More is a manualized therapy, so it's really spelled out word for word in my book. And so if a peer support person got an adequate level of training and then followed the manual, I think would probably do some good. So that's my initial answer to this. I think uh, my other thought on this is connects to what I just raised a few minutes ago, which is the idea that teaching people how to savor natural, healthy pleasure, joy, and meaning in life might actually be a treatment for addiction. I think that idea could be used by anybody, care navigators, peer support specialists, to help folks in recovery. So trying to get the person with the substance use disorder to start to focus on positive events in their life, to actually encourage them to spend time not only doing things and being in places and being with people that make them feel good naturally, but also talking to them about the concept that if you focus your attention when you're having a pleasant experience and you focus your attention on that pleasant experience, and you really try to richly enjoy the sights and the sounds and the colors and the smells and the tastes of that experience, and then you notice how your mind and your body respond to that experience and really try to appreciate it deeply, savor it, kind of like if you go to an overpriced restaurant and they give you a tiny little morsel of food, and you really want to make it last, right? Because there's not much food there and you paid a lot of good money for it. So you eat it really slowly and you savor every bite of it. Well, you not only can you do that with food, you can do that with all of life, with all of the good things in life. And so I think maybe presenting that idea would be useful, even if you're not doing the full more intervention. And relatedly, I think there are a lot of simple mindfulness practices that you can teach people. Of course, there are apps out there. You can find audio recordings of mindfulness meditation practices, and those I think are pretty helpful, even if you're not doing a full more intervention. Those are some ideas I had, but I think to do it with highest quality, it probably is most appropriate to refer them to a trained more therapist. Okay. Next question: how are positive affect and self-transcendence operationalized or measured in your studies? Positive affect is measured with standardized questionnaires like the positive and negative affect schedule, the PANAS. For example, that's one way we measure it. So it's a questionnaire. It asks people to rate to what extent or how frequently they experience a range of positive emotions like joy, relaxation, excitement, calm, happiness, so on and so forth. How is self-transcendence measured in our studies? We use an instrument that we developed called the Non-Dual Awareness Dimensional Assessment, or NADA. And we developed this questionnaire using, we basically took all of the existing questionnaires that were measuring mystical experiences and altered states of consciousness, etc. And we did a factor analysis of the items of those scales to boil those down. I think we either had 6 or 7 questionnaires, and we boiled them down into the 13 most sensitive questions to tap this construct of self-transcendence. Which, as a reminder, when I talked about this last week, this is the idea that we can connect with something greater than ourselves, and that experience often has kind of 2 flavors. One flavor is the experience of your normal sense of self starting to become quiet or actually starting to fade away. So instead of being preoccupied with thoughts about yourself, instead of being kind of lost in your thoughts about yourself or ruminating about yourself and your life, instead of being egotistical and thinking, you're hot doo-doo, that's a very self-oriented, selfish, egocentric kind of mentality. But in self-transcendence, you can have an experience where all of that self-related thinking starts to quiet down, and maybe even the sense of yourself as a separate and permanent, a separate entity that is distinct from the world starts to fade away and becomes very quiet. And that connects to the other aspect of self-transcendence, which is this sense of oneness between the self and the world. So feeling connected to the people around you, feeling connected to the natural environment around you, and this can become more and more extreme to the point in which you feel a sense of connection with all things, or with the universe. And these kind of experiences are actually often labeled as spiritual type of experiences. But I think they also connect with the idea in 12-step program of connecting with a higher power, surrendering to a higher power. And these experiences also have a quality of a very strong positive emotional quality. So maybe feelings of bliss, feelings of energy coursing through your body, feelings of ecstatic joy, or deep, all-pervading kind of peace. So people have these experiences. Sometimes they have these experiences when they practice mindfulness meditation, and even inexperienced people with very little mindfulness meditation experience sometimes tap into these states, or have tastes of these self-transcendent states. And that's what our data has shown. In fact, when we did the original scale development paper, we surveyed, I think it was 500, 300, something like that, people. And about 50% of people that we surveyed, and this was not a survey of people who meditated, this was just a survey of average folks. About 50% reported having these types of experiences, at least sometimes, which was really actually kind of shocking to me. I didn't think it was going to be that high, but that was what people reported. So people do have tastes of these types of experiences, and it seems, and our data shows actually that when they get mindfulness training through an intervention like MORE, these experiences increase to a greater extent. And the larger the increase in the frequency and intensity of having these self-transcendent experiences, the greater the reduction in opioid use and opioid misuse. And that's really interesting to me.
Thanks for that was actually my question, and I thank you for that answer. I was just actually going to ask if you could say the name of the measure one more time. I just wanted to try to find that.
Oh, sure. It's called the Non-Dual Awareness Dimensional Assessment. I think we published it in 2018 in the Journal of Psychological Assessment. And non-dual awareness is this idea. Well, it's sort of the opposite of dual awareness. So dual awareness is what we normally go through life with. So we have the sense that we are a self, that we are, and then there's a world. So I'm me, and there's the world is outside of me. I'm a subject, and the world is my object, and I'm paying attention to my object. So there's two things, right? There's the subject and the object. So that's dual awareness. So non-dual awareness is the subject and the object are one thing. There's the self and the world are connected. Can you explain more about frontal midline theta and its relationship with pleasure and pain pathways in general. Yeah, and this connects to what we just talked about. So some of the most interesting stuff that I found as a scientist really surround this topic. And this is really pretty new in my work. So we found, as a reminder, we found in 2 separate randomized controlled studies in people who took opioids long term, that when we trained them with more, so they went through the full 8-week more intervention, and we brought them into the lab and had them practice mindfulness meditation. We measured their brain waves with EEG, and we found that those who received the mindfulness training through more were able to increase their frontal midline theta EEG activity. So EEG activity generally in this area of the scalp. And the greater the increase in the theta EEG during mindfulness meditation, the deeper the state of self-transcendence the patient reported. So when the patients were patients who reported this sense of their self starting to fade away, or this feeling of oneness with the world around them, or this feeling of bliss arising during mindfulness meditation, the greater that occurred, the greater the theta activity in their brain. And the greater the theta activity in their brain, the less they used opioids and the less they misused opioids. So the increase, and actually the increase in the theta, we say it's statistically mediated. So it appeared to have some causal relationship on reducing opioid use and misuse. So the more the theta increased, that led to decreases in opioid use in the future. So that was really pretty exciting because first of all, no one had ever shown that before. In the literature, there's a lot that's known about frontal midline theta. It's a well-known biomarker of cognitive control. So when you're doing a task, like let's say right now, you're trying to pay attention to me. Maybe you have a lot of distractions going on around you in your office. Maybe there's noises around. Maybe you have other competing demands. Your phone's ringing. You're getting emails popping up. Maybe you're just bored because I'm a boring guy. But in any case, you're trying to stay focused on me, and you're trying to prevent these distractors from pulling you off target. When you're doing that, there's the theta activity is increasing in midline brain regions like the anterior cingulate cortex and the medial prefrontal cortex. The neurons in those brain regions are starting to fire in a theta pattern. And that theta activity seems to be really important for helping people to stay focused, keep the focus. So what does that have to do with self-transcendence and addiction? That's kind of weird, right? Well, I think if you think about it, it actually makes quite a bit of sense, because what's happening in mindfulness meditation is you're focusing on an object, and it could be anything. It could be the feeling of your breath, but you could also be focusing on something outside of yourself, like focusing on a beautiful sunset, or focusing on the sound of a bird singing in the tree, or focusing on some flowers growing up in the garden. And that's really what the savoring practice that we teach is all about, right? Focusing your mindfulness on some pleasant everyday event. So the more you focus on this object, and the less distracted you become, eventually you start to become so focused and so absorbed in this object that you're focusing on, that the distinction between the subject who's observing and the object that's being observed starts to fade away. You're just totally locked in. You're totally locked into this moment. You're totally locked into this experience. And we would expect that there would be an increase in theta during that activity, because as I described to you, that theta is really important for controlling your focus of your mind and preventing you from becoming distracted. So really, it's reflecting this capacity to become deeply absorbed and even one with the thing you're observing. So what does that have to do with addiction? Well, I think there's a couple answers there. One is that addiction involves a loss of self-control. And what we're really talking about when we're talking about focusing the mind to the point of becoming so intensely focused that you can't be distracted from what you're doing. That's on one level, that's self-control right there, right? It takes a lot of self-control to do that. So you're so on one level, I think you're strengthening the muscle of the mind or the muscle of the brain to build up that self-control, which then becomes like a resource that you can use to make good decisions in your life. So it's not just strengthening your ability to practice mindfulness, but it bleeds over into the rest of your life because you're building that strength of self-control. Inhibitory control is the term we use in neuroscience. But I think there's another piece to it too, and this one is harder to explain. If you read my Science Advances paper that got published in October, I give a long explanation of this, and probably better than I can do right now verbally with my mouth, but so remember I told you that the experience of self-transcendence has this tone of positivity. You know, when you enter into this state, you feel either a deep sense of peace, or you may even feel bliss. You might even feel waves of a blissful warmth or a feeling of energy moving through your body, some sort of joy, some sort of pleasurable tingling starts to spread through your body, what have you. And in other words, the deep state of mindfulness that brings out this frontal midline theta also has this quality of pleasure. And man, I don't know, I'm just guessing, and now I'm just spitballing here, but you know how when you do something and that you really enjoy doing and you really get lost in it, you know, you just, whatever it is, whether it's you go to a concert of your favorite band, or you're taking a walk in the woods, or you like to knit and you're knitting, or sitting on your porch, you know, drinking a cup of tea, listening to the birds singing, whatever, when you're doing an experience and you really become just deeply immersed into it, it feels good, right? So maybe this is a reflection of that. So it could be that the person is, as they go deeply into the state, it's generating pleasure. It's generating natural, healthy pleasure. And people in addiction have a deficit of that. And they're always looking outside of themselves for something external to themselves to make themselves feel good. I mean, that's what they're seeking the drug for that. But if the person can make themselves feel good naturally through the altered state that they generate with mindfulness meditation practice, in other words, and this was my provocative idea actually around this paper, and I gave a press release about this. So I think it's pretty provocative, and hope this doesn't offend you, but my idea essentially is that the person's learning how to get themselves high naturally on their own. So if you can learn how to make yourself high naturally on your own through mindfulness meditation, then why do you need to seek it outside of yourself from a drug? And actually, if you look at the types of experiences that people report having, these self-transcendent experiences, this type of experience is not that extremely different from what people report on psychedelics. You know, there are obviously differences. It's not the exact same thing, but both psychedelics and meditation can produce these self-transcendent types of experiences. So I think that's just further evidence of this idea here, that maybe the person is learning how to get themselves high naturally, safely, with their own mind, And if they can learn how to do that, then they don't need to seek it outside of themselves with the drug. So that's the concept. In terms of the neuroscience, that gets really complicated. I guess I'll just got a bunch of time here, so I'm just riffing so I can keep talking about it. Basically, this is going to get heavy, so stay focused. So when your mind is wandering, you're not focused on a task. When your mind is wandering and you're just kind of lost in your thoughts about yourself, there's a network of brain structures called the default mode network that is hyperactive. And the default mode network is thought to instantiate your sense of self and your self-referential thinking, your daydreaming, mentalizing, time traveling, thinking about the past or the future. When you're really getting lost in your head and you're pulled away from the world, there's greater activity in the default mode network. Well, what's really interesting is that when the default mode network activity goes up, frontal midline theta activity goes down. But when you're focused intensely on a task that requires you to use cognitive control to prevent yourself from getting distracted, as I described to you earlier, then you see this increase in frontal midline theta EEG activity. So as frontal midline theta goes up, the default mode activity goes down. And it's well known that in addiction, that people with addiction have messed up default mode activity in their brains, and that default mode, the aberrant, the unhealthy, the maladaptive default mode network functioning in addiction is associated with poor outcomes among people with addiction. So, when you're in this heightened frontal midline theta state during mindfulness meditation, you're suppressing that default mode activity. And there are some connections there's a relationship between default mode network activity and dopamine release in the brain. And there's some theory that potentially the dopaminergic activity, a lot of dopaminergic activity gets kind of co-opted by the default mode network. It's using a lot of the brain's resources for attention and mental processing. They're getting which are in part connected to dopamine. That's getting used up, if you will, by spinning your wheels in your head. But if you can have this moment where that activity becomes quiet as you focus on the task and you get this increased frontal midline theta, maybe it's freeing up that dopamine. And so it could be that that's linked with this increased sense of reward that comes with the experience. But who knows? Nobody knows. The science isn't there yet. That's just a hypothesis. And if you're interested in that, you could read my paper. If you can bear with the scientific gobbledygook. What's the relationship between frontal midline theta and pain? I think there is one, but I actually am embarrassed to say I know less about that than what I just described to you. Have there been any studies related to utilizing more mindfulness techniques in general and their effectiveness in individuals with aphantasia? I don't know, but I think aphantasia is like the inability to see visual imagery, something like that. Mindfulness is not a visualization technique. Let's have a common understanding there. Now, many people use quote unquote guided meditations that involve visualization, and actually, even to make things more confusing, in many of the ancient meditative traditions, like for example in Tibet, they do have visualization meditations where you actually try to visualize a complex image. But that's not what, by and large, that's not what we're teaching in MORE, for example. We're asking people, and other mindfulness-based interventions, we're asking people to focus on body sensation. So the sensation of the of the breath moving into their nostrils, for example, or the sensation of the rising and the falling of their belly as they breathe. Or, as I described earlier, we're teaching savoring techniques. So we're asking people focus on a beautiful object like a flower. So that doesn't require imagination, because we're actually bringing the attention into the present moment to focus on something that is there, not something that they're imagining or making up. So, if meditation was dependent on visualization, then maybe people with aphantasia might not benefit from it as much. But mindfulness meditation really isn't dependent on visualization. It's more about focusing attention on what is present in the body or outside the body. It doesn't really require imagination.
Yeah, if anyone has any additional questions, these are the ones that were submitted, but if someone has a question, you can put it in the chat, or you can send me a direct message. You can raise your hand. Lisa?
Have you done any studies with more technique in relation to pregnancy, pregnant women either in labor, for labor pain, or pregnant women with substance use disorder?
Great question. We have studied more. One of my PhD students did her dissertation of more for women with an opioid use disorder who were pregnant. And so this was probably the toughest dissertation I ever saw. I mean, it was really hard because the timing of getting these people into the treatment before they had their babies, and then some of these women were coming out of prison or were going into prison, and it was just it was logistically really tough study. So the sample, it was a randomized controlled trial actually, and the sample ended up being pretty small. And it was hard for her to deliver the full 8 weeks or more because, like I said, because these women were really, there was a lot of chaos in their lives. They were moving in and out of facilities. But what she did find was that the more intervention reduced opioid craving over the first few sessions of the therapy, and it also reduced emotional distress significantly. So it showed some promise. That study definitely needs to be redone and redone well with a larger sample, but it looked like it was potentially working. And one of the things we did in that study, which was really pretty cool, was in terms of savoring, we taught baby savoring, but we taught baby savoring before the baby was born. So the mom, would get in touch with the baby in the womb and try to really feel it moving around and connect with it emotionally and sense the feelings of meaning that come from knowing that you're mother and that you're caring for this thing and you're helping it, this being, and you're helping it grow, and to really make the pregnancy itself a source of pleasure, which I know is probably maybe seems might seem to be hard to feel pleasure when you feel so physically uncomfortable, especially in the late trimester of having a baby. But I think you get my point. So that I think that was a really cool, rich part of the intervention. So I'd like to see that study redone because it showed some promise. And the idea was really, can you get, from a savoring perspective, can you get this sense of pleasure and reward and meaning from connecting with your child, and making that your purpose in life. And if you strengthen that, then maybe you won't feel the need for the drug as much. So
More like bonding techniques. Is that what they did during the pregnancy to make them
Yes.
bond more
Exactly.
efficiently?
Bonding. Exactly. You really using mindfulness to deepen that sense of bond. we've never studied more with labor pain, but I think others have, and in general, mind-body practices like mindfulness and hypnosis are pretty useful for alleviating labor pain.
Anyone else have any question? I had one question, and I think it might have been touched on, so I apologize if this is somewhat of a repeat, but I was looking at some of the applications of more, and one of them was online addiction. So I was curious about the application of more in behavioral addictions versus, substance use addictions.
Yeah, good question. Another PhD student at UNC Chapel Hill did her dissertation on more as a treatment for video game addiction, and this was a pretty solid study. We published it in the Psychology of Addictive Behaviors a few years ago, and she found this was a small randomized controlled trial, and she found that more worked, that it significantly decreased symptoms of video game addiction and significantly decreased craving to play video games compared to a supportive therapy control condition. So that was really pretty exciting, actually. We made a modified version of more that were, instead of focusing on drugs, it was focused on video games, and I definitely think video games are addictive. So it was exciting to see that effect in a behavioral addiction. Nobody studied it with, as far as I know, no one studied it with gambling addiction, or sex addiction, which I think is another interesting area. We have looked a little bit at more for overeating, obesity. I think, really coming at that from a addictive behavior kind of framework. And we did one pilot randomized controlled trial. It's another dissertation. This was in people with cancer who were obese, and obesity is a risk factor for having a recurrence of your cancer. So it's really important that people who have cancer, try to keep themselves from being obese. So we studied more combined with exercise and nutrition counseling versus exercise and nutrition counseling. So it was a really, really strong control group. And we didn't find any differences in weight at the follow-up point between the two groups. So it could be that more didn't work, but probably more likely what it was measuring weight in people with cancer is a really tricky thing, because some people are losing weight because of the cancer itself. Some people are losing weight because of the chemotherapies they're on. Some people are gaining weight because of the medications they're on. So it's really messy with lots of confounding variables. So it's probably unwise for us to even look at weight, but that was our primary outcome. But what we did find some positive signals for more patients who were treated with more reported less external eating, like eating when you're cued by, when you're triggered by a cue. So if you walk past your cabinet, your kitchen cabinet, and you see a box of cookies in there, and then you want that cookie. So more decreased externally cued eating. And we also used a dot probe task in that study. And I don't know if you remember me talking about this, but that's a task from neuroscience where you have two pictures side by side on the computer screen. And typically this has been done to measure drug addiction. So you have a drug cue on one side of the screen, you have a neutral cue, and then they disappear and a dot pops up behind one of the two pictures. And you have to hit the arrow key on your computer. So hit the left arrow when the dot shows up on the left-hand side of the screen, hit the right arrow when it shows up on the right-hand side of the screen. And then the computer measures reaction times. And people with substance use disorders are faster to find the dot when it replaces the drug picture than when it replaces the neutral picture, because their attention is getting captured by the drug. They're getting triggered by that drug cue. Well, people with obesity have the same kind of thing, except their attention gets captured by images of really rich food. So whatever, bacon cheeseburger, ice cream sundae, that will grab the person's attention. And this is a well-known phenomenon in the obesity literature. So we found that more decreased that food attentional bias. So after the more intervention, patient's attention was less captured by the food cue. And we also found that more in this study, we also did something kind of cool. We showed people images of naturally rewarding images. So images of smiling babies and lovers holding hands and beautiful sunsets. And we measured smiling. So we measured the strength of people's smiles by putting electrodes on their cheek. And we found that more increased the strength of smiling to natural, healthy pleasure cues. But what was really quite amazing, and I don't think anybody ever reads this paper or cites this paper, but I think the findings are really pretty amazing. We found that the more people smiled to natural, healthy pleasure images, the less their attention was captured by the food cue. So that was a really strong test of my restructuring reward hypothesis, which states that if you can help people to shift from valuing the drug, and in this case, the drug is the unhealthy food, you can help them to shift from valuing the drug back to valuing natural, healthy reward. This is going to reduce the addictive behavior. And that's basically what we saw in this study. So that was cool. And now one of my colleagues at University of Utah is doing a study of to help prevent weight regain in people who've lost a bunch of weight, either through bariatric surgery or through exercise and diet. You know, I'm sure you guys all know it's very common when you lose a bunch of weight to gain it back eventually. It's hard to keep the weight off. So the hope here is that more will prevent the weight regain, but we don't know yet. The study's not done. So those are my thoughts about behavioral addictions, but the video game addiction results were quite significant, actually. And it was in a small sample. I think it was only 30, maybe 40 people, but so the study probably needs to be done again and in a bigger sample, but it was pretty clear that more seemed to be helpful for this for this problem.
Great, thank you.
It hasn't helped me from being addicted to my own phone, though, I can tell you that much.
Yes, that's a tough one.
It's a tough one.
Does anybody else have any questions? I know that we were going to end this session with Dr. Garland leading us through an exercise, but I do want to give appropriate space for people that might have additional questions. All right, I think we are ready to move on. So thank you for those that submitted questions, and thank you for those responses.
All right. Yeah, so I thought you might be interested in doing a mindfulness of craving exercise. So hopefully you brought your sweet treat. So to do this, you need a sweet treat. So I got some chocolate here, but cookies or candy or something naughty will suffice. Does everybody have something? Or does anybody have something? Give me a thumbs up if you got something to practice with here. All right, I see a couple people have something. This exercise is going to be like pretty meaningless if you don't have anything to practice with. I guess you can observe it as you could just observe it to check out what the technique's like, but it's a lot better if you actually do it. So let's do it. So first we can begin with some simple mindful breathing. So you can allow your eyes to close. And just noticing the sensation of the breath moving into your nostrils as you breathe in. Noticing the temperature of that air. Its warmth or coolness. Just noticing the natural sensation of the breath in this moment. And when the mind is a little more focused, a little more settled, and a little more open, you can allow your eyes to open, and you can hold up this sweet treat in front of yourself and just bring it in front of your face, maybe 6 inches away. And begin to observe this sweet treat, noticing its color. Maybe noticing that it has tiny crystals of sugar on it that kind of shine in the light. And you can become aware of the exact moment when you experience an urge to eat this treat. But don't eat it yet. And we have this word, urge. But what is it really? Maybe the mouth is filling up with saliva. Maybe you notice your heart starting to beat faster, or a feeling of jitteriness or hunger. Maybe there are thoughts or feelings associated with this sensation. Thoughts like, why can't I just eat this thing already? Maybe a feeling of anticipation or irritation. And now, bring the sweet treat even closer to your nose and your lips and smell it, but don't eat it yet. And you can become aware of the exact moment when you experience the urge to eat this treat. Noticing the sensations that make up the urge. Perhaps the mouth filling with saliva. Maybe a feeling of jitteriness or tension. Maybe the heart's beating faster. You can notice if there are thoughts or emotions associated with those sensations. And then you can notice, do the sensations of the urge have a center? Do they have edges? Are there spaces inside the sensation where the sensation is not? That's right. And if at any moment the sensations of the urge become too intense, you can always move the sweet treat away from your face And shift the focus of your attention to your breath as a way to recenter yourself, as a way to step back from urges. And then imagining as if you could send the breath into those sensations to soften them, like water seeping into soil. Imagining breathing into those sensations now. That's right. And then return the focus of the attention back into the sensations of the urge, to notice how they're changing over time. Maybe the quality of the sensations is changing. In a jitteriness, become a warmth, or a tightness, become a tingling, or a sense of energy, or spaciousness. Maybe the sensations are changing in intensity. Perhaps they're fading away. Or maybe they first reach a peak and then begin to fade away, like a wave rolling at sea. And you can notice, do the sensations of the urge have a center? Do they have edges? Are there spaces inside the urge where the urge is not? That's right. And then you can let those sensations go. And now take a few long moments to consciously contemplate why you really want to free yourself from this urge. You can think about how indulging in this urge in the past has hurt you and hurt the people that you love. And then you can think about how freeing yourself from this urge will help you and help the people that you love. That's right. And then you can let those thoughts go. And return the focus of the attention back to the breath. Just noticing the sensation of the breath moving into the nostrils. Noticing its warmth or coolness. And it really doesn't matter how many times the mind wanders. Because each time that the mind wanders, and you notice where it wanders off to, and acknowledge and accept that thought or feeling or urge, and let it go. And return the focus of the attention back to the breath. You are learning to step back. To step back. To step back from thoughts and feelings into the open space of mindfulness. You're strengthening mindfulness. And soon you can begin to notice that thoughts and urges come and go all on their own, like clouds passing in a clear blue sky. And like thoughts, and like clouds, mental experiences seem to come out of nowhere and change shape and fade into the distance all on their own. There's no need to hold on to them or to push them away. You can just let them go. And there's a part of the mind, like those thoughts or urges, passing like clouds. But there is a deeper part of the mind that is more like the space in which the clouds pass. The observing awareness. That is open, vast, spotless, stainless, and free. Just watching, just observing peacefully. And you can focus on that part of the mind now, or you can continue to focus on the breath. That's right. And now you can take one long moment to focus on the best parts of this experience, appreciating and savoring whatever positive experiences have come up for you during this practice. Or you can continue to focus on the breath. That's right. That's right. And when a deeper part of your mind knows that each time that you practice this, it will become easier and easier to use mindfulness to overcome cravings. You may feel a little more centered, a little more comfortable, and a little more confident when you complete this practice and bring your attention back to our meeting. And then you can choose to eat this sweet treat, or you can not eat it. Whatever you choose to do is right. All right. That was the mindfulness of craving technique that we do and more. That when we're doing this with people with substance use disorders, there's actually one more phase to this, which is we first have them smell the chocolate, create the craving, and then we have them use mindfulness to zoom into the experience and notice the sensation, so on and so forth. And then we have them imagine that instead of holding chocolate, we have them imagine that they're holding up their drug of addiction in their hand. And we ask them to imagine seeing the drug of addiction and remembering how it makes them feel, and really to create a craving for that drug. And then we follow the same process of having them zoom into it, notice the sensations, imagine sending the breath into them, thinking about the negative consequences, etc. So it goes something like that. I hope that gave you a sense. And this technique is coming in the full 8-week more intervention. We don't do this technique until session 5. So patients are learning week after week. They're building up their mindfulness with basic mindfulness practices to kind of get them ready for this big challenge that we then set before them.
All right, thank you so much for that. That was excellent.